Okay, so I'm going to be sending you 2 recordings today, one from the first part and then one from now. All right, so has everybody seen their study guide? You all know you have it, right? What are my rules of thumb for preparing for an exam?
Don't you only use your study guide?
What?
Use all of your notes, not just the study guide.
Well, I would say that using your study guide as the point source, the initial point source, because the study guide was developed from lecture, from notes, from readings, from case studies, from homework. Okay, so the study guide is a really good summary of what's been covered for weeks 7, 8, and 9, which is what your exam is going to be on. Okay, so as you go through your study guide, make sure you have an understanding of each of the topics. If you don't, then you're going to have to go back and do your due diligence, go back through your lectures, go back through your notes, go back through the readings. Okay, this first page is nothing different. 75 minutes, 50 questions, few math questions. Okay, let's go over the different topics. Okay, there are going to be questions. There are going to be questions about sexually transmitted diseases. Okay, in particular, there's going to be questions about HIV, chlamydia, gonorrhea, syphilis, herpes, and HPV. I can guarantee you there's going to be questions on each one of those 5 STDs. I've given you what I believe are the most important pieces of information with regards to each one of those. Okay, so know each of these bullet points as it relates to the topic. Here's what here are the 6 bullet points I need you to know about HIV. Okay, here are the 6 bullet points I need you to know about chlamydia. You're going to get asked questions on each of these. Okay, so that's your first section, is your STDs. Second area we cover is infection prevention and control. And we even list out for you, if you have to go back and read up on these sections, here's where it is. Your STD is chapter 41 in your Med-Surg book. Your infection prevention and control is chapter 17, your fundamentals. Okay, what do we know about infection prevention and control? Okay, we discussed hepatitis. Here's what you need to know about hepatitis. It's 4 bullets on that. Another communicable disease, infectious disease, tuberculosis, smallpox, food, illness, and waterborne safety. So there's your 5 infectious communicable diseases that you need to know about. You're going to get asked about each one of those. Okay. What do we want to know about home health? What is home health? Okay, home health is we're practicing in the patient client's environment. Right? We're giving individualized care to clients or families. Okay, there's several questions on the exam about home health. Here's the information I need you to know about home health. There's lots of bullets. Okay. What's a case manager? What's a case manager? What's case management? What's a case manager?
Is in charge of helping the patient with particular needs or placements in rehab facilities, or helping them find retirement home, and be like the middle advocate in between the patient and like the insurance and the agencies, or places that they need to be placed on. They like
absolutely
work hand by hand with everyone, pretty much.
You're the coordinator of care. That's how I like to describe case managers. Okay, case management is usually reserved for the more complex kinds of clients, maybe with multiple comorbidities. Let's say you have a client with mental health issues and substance abuse issues. Okay, so case managers work to coordinate all the care. Some of the different groups, like Alicia just said, that you may be working with discharge nurse, you may be working with home health agency, you may be working with PT or OT or speech or respiratory or medical equipment. What are the needs of the client going from one place to another? What are the resources available for that client? Okay, so their job is to coordinate care. Okay, and case manager's role is really, really primarily being the patient advocate. Okay, so case management competency, if you're going to practice in case management, you need to have knowledge of community resources and financing. You need to have excellent written and oral communication skills, documentation skills, negotiation, conflict resolution. You might be working with insurance companies. Critical thinking, be able to prioritize a patient with multiple comorbidities and what they might need. Okay. Case management is a very important role in the nursing profession. Okay, and recently case management is very labor intensive, time consuming, and costly. Why? Because of the increasing needs of the clients and the increase in the numbers of complex caseloads. Okay. We just talked about human violence and abuse. Okay, so there's a section about that. You will have questions about human violence and abuse. Please be familiar with these 5 bullets. And then neglect. Okay, community nurses need to be aware of the signs of neglect. They witness child or elderly patient not having their basic needs met. That's neglect. And then disaster management, chapter 44 in your med-surg book. Here's what you need to know about disaster management. Why is disaster management covered in this class?
Because when disasters hit, you have to go out and take care of people.
Disaster is disaster management or disaster preparation or when it's happening or post care is all going to involve the community and public health nurse. So nurses are expected to participate in any cycle of the disaster preparation and management. We know there's 2 kinds of disasters, man-made and natural. Please be able to identify which is which. Have a look at this section. Okay. There's another section on hospital-associated infections, contact precautions, and airborne precautions. There'll be questions about this topic on your exam. And it talks about proper hygiene, proper hand hygiene being the single most important aspect of medical asepsis and infection control. Gives you a couple of examples that we need to be practicing. N95s for airborne diseases. Private rooms or negative pressure rooms of airborne disease. And then what are some teaching tools you can use in the home with regards to contact precautions? Right, with the use of gloves when it comes to any contact with wound secretions, linens, dressings. Okay. And then we talked about cultural considerations of religious influences on patient care. Talked about differences in food preferences, smoking, drug use, herbal medicine. Different cultures have different beliefs. Nutrition, they have different beliefs about nutrition, caffeine, alcohol, food preparation, reading materials. It's all part of your cultural competence. And there is a section you're going to get asked a few questions about the LVN scope of practice. Okay, so please review these bullets. In fact, let's review them now. You need to know what you can and cannot be delegated. What can you delegate to a nursing assistant? What can you not delegate to a nursing assistant? What kind of patients cannot be assigned to nursing assistants? What's the answer?
That's a critical ill.
Mm-hmm. Right. So when you're delegating to an unlicensed assistive personnel, you have to inquire if the nursing assistant is willing to take the responsibility. Right? You guys should know that, right?
Wouldn't also be a one, like if they know how to do it, like the task that you're assigning, if they know what they're doing, like what the task is to be done, how to properly do it and all that.
Well, that's part of the job of an LPN. That's what it says in the last bullet. When delegating to a nursing assistant, you must give us specific instructions as to what is to be done, how it's to be done, what needs to be reported, and that you as the LVN, LPN are responsible for the outcome of delegated care. Just like when I was in the schools as the RN, I was responsible for all of the health aides in the clinic who did bell-to-bell care. I had to train and delegate them. Right. And as Tyan said, nursing assistants are not assigned patients who have an unstable condition. Okay. And then I put a statement in there about disease occurrence and reporting. What do you need to know? You need to know that all occurrences related to a disease that is considered reportable needs to be reported to the local state health department. You're going to get asked about that. Okay. So this is an excellent summary, the study guide of what's expected for you to know on the exam. Broken out into different sections that we've covered over the last 3 weeks. And if you have a good understanding and can apply this information to, say, clinical judgment, let's say you have a patient with this condition and you are a patient with a certain disease or condition that we've talked about, how do you apply the knowledge to clinical judgment? Okay. That's what this study guide's about. If you don't have a good understanding of the study guide, please go back and review your lectures, your notes, your readings. Okay. But you should have a good understanding of the study guide. You really should at this point. We've covered everything on there. And if after you do your due diligence and you prepare for the exam and set up a tutoring session with me, if you're still struggling with certain topics or certain concepts, and we'll review them before the exam. Okay. Questions? How about a few minutes of the gift of time? How are you guys coming on your HESI prep assignment? Honestly, how are you coming? Is it almost done? I've had a few people turn it in already. How about if I give you 20 minutes of the gift of time and you continue to work on your HESI study guide? You can fill out the whole the sections of cultural competency and violence after today. Okay. Questions? Okay, well, I'll end class early then to work on your 2 assignments. Remember, these 2 assignments are worth 10%. Do not blow off these assignments. Do not. You don't turn in these assignments, they're going to take your total grade that's above a 78, below a 78 if you don't turn these in. 10%. All right, I need for Christina to stay on, Tyan to stay on, and Alicia to stay on. Otherwise, I hope you guys have a fantastic week. Work on scheduling, work on your 2 big projects, and work on scheduling your HESI. Okay? Everybody have a good week.